Hi everyone, it's Ambria. We are going to go over a teaching plan for a patient who was just diagnosed with syphilis. Here are the learning objectives. By the end of the presentation, you should know how syphilis is contracted, what the standard treatment for syphilis is, how to prevent recurrence, and demonstrate some therapeutic communication techniques when working with this patient. Okay, here are the test plan topics that I correlated with this. There's a lot of health promotion and maintenance, psychosocial integrity, of course, for the therapeutic communication, safety and infection control, reduction of risk potential, and pharmacological and parenteral therapies. Even though they have already been diagnosed with syphilis, we still have to assess them. We have to assess their readiness to learn. How do they learn best? Are there any barriers to learning? And how we're going to teach this client. We need to identify risk factors um, that put them at higher risk for contracting STIs. So, like high risk sexual behaviors, multiple partners, unprotected sex, things like that. And then we are going to assess for medication allergies, but we will talk about that when we get to the treatment slide. So we're going to start by just giving them a little rundown of what syphilis is. Um, I think a lot of people assume that syphilis is like an old STI that like people don't get anymore, so they're not really educated about it. But that's a misconception that we could clear up with them, and let them know that it is an STI and it's caused by a bacteria, which means that it could be treated with antibiotics. It is spread through direct sexual contact with an infected sore or rash during vaginal, oral, or anal sex. Okay, so that's how it's contracted. They may say, well, my partner wasn't showing any symptoms, or I wasn't showing any symptoms. It doesn't matter. Even if the sores are not noticed, they might not hurt or anything like that, they can still be spread. And syphilis is not spread by sitting on like a toilet seat or sharing food, um, holding hands, anything like that. So, yeah. Signs, symptoms, and stages. So it might start out with a sore, it might not. It may turn into a skin rash. Latent, there's no visible signs or symptoms, but the infection is still in the body. And then if it gets to the tertiary stage, it can damage the organs. If for some reason this patient like did not want to get treatment, they're just like not sure, whatever, you never know. This is good to let them know that like it will progress, like it's not just gonna go away. And also, it's good for them to know the signs, symptoms, and stages because if they have to go let one of their sexual partners know, then they could tell them about the symptoms and like how it progresses and things like that. Okay, testing. So they've already been tested, and we know that because they've been diagnosed. But we still got to talk about it because after treatment, you need follow-up blood tests to make sure the infection is gone. And they usually do this at 6 months and 12 months. Any sexual partners need to be tested and treated to prevent reinfection. Also, it would be good for them to get additional STI testing just because you never know. Yeah. Treatment. This goes along with safety and infection control, pharmacological and parenteral therapies. So, the standard treatment is a single dose of penicillin G given intramuscularly. We are going to assess their medication allergies. So, if they have a penicillin allergy, they can do doxycycline or tetracycline. They'll do a course of those antibiotics by mouth, um, regardless of whichever one it has to be. They still need to come be retested, even if they feel better or there's no symptoms or anything like that. Preventing recurrence, part of health promotion and maintenance. I have a mnemonic here: care, curable, abstain from sex until treatment is complete, retest, ensure partners are treated. So complete all treatments as prescribed. Maybe it's like the single dose of penicillin, or if they had to do like doxy or tetracycline, a course of those. Avoid sexual contact until treatment is complete. Make sure sexual partners are tested and treated. Okay. And then over here on the side is just like a little graphic information thing. But yeah, also this kind of goes back to like assessing risk factors, like maybe like if you're dealing with a patient who is like a sex worker or something like that, you never know because like we come across all types of patients. They need to know to be safe and not spread the infection around. So that's why preventing recurrence, like this education on this slide, is so important. All right, communicating with patients about an STI diagnosis. This is going to go along with the psychosocial integrity. We're going to ensure privacy, private room. We're not talking in the hallways and spaces, chatting with another nurse about it because that's just rude. We're going to be non-judgmental. We're going to be empathetic, and we're going to reduce the stigma. We're never going to lie to a patient, but there is a big stigma regarding STIs. It doesn't matter which one, if you're talking about like syphilis, chlamydia, it doesn't matter. So this patient may be feeling a lot of shame or embarrassment. They might just be like overthinking in their head. We want to encourage them to ask questions. But yeah, we just want to make them comfortable so that we can get the most information from them to better educate them and to make sure they know what their treatment is going to look like and what they need to do next. All right, I have a question. I have 4 questions. Okay, number 1. Which client statement indicates a correct understanding of how syphilis is transmitted? You can pause it. I'm just going to pause for a second. Okay, and the answer is C. D is just not true. That's just a ridiculous answer. B, no. And A is false. They don't have to be visible. You can be asymptomatic and still spread the infection. Okay. Number 2, a client is diagnosed with primary syphilis. Which medication does the nurse anticipate will be prescribed as first-line treatment? Okay, the answer is C. Um, and then, as I said before, if they're allergic to penicillin, then they would do the doxycycline, but penicillin is the first line standard. Number 3, a client was treated for syphilis with penicillin G 4 months ago. At a follow-up visit, the client's RPR titer is higher than the previous result. Which action should the nurse take first? Okay. And the answer is C. Number 4. A client newly diagnosed with syphilis. A client newly diagnosed with syphilis states, I feel ashamed. I must have done something wrong. Which response by the nurse is most therapeutic? B is the answer. Okay. I'm going to get out of this PowerPoint because I have some handouts and I could not figure out how to get them into the PowerPoint. So I'm just going to open it like this. Okay. This is a pamphlet, like a trifold little brochure. So it looks backwards, but it's not, because if you printed it out and you folded it up, that's how it would be. But this is just a little pamphlet about syphilis, how to prevent it, the signs and symptoms, testing, and treatment. Okay, and here is the mnemonic. I just typed them out because I'm going to post them under the video, but here's this one for the patient education. And then here's one for the stages. Sore, spots, silent, serious. Is good to use if you're trying to remember like the 4 stages. And then I have like a little worksheet where you just take the letter of the statement and you will put it where it's supposed to be. And then there's a little reflection, and the answers are down here. But yeah, this is about how it's contracted, how it's treated, and how you would prevent recurrence. Also, my references are going to be at the end of the outline page that is also going to be posted. But that's all I got for the syphilis teaching plan. Thanks, guys.